This is Dr. Paul Firnhaber, and it's time for 10 Minutes of Truth. So I'm here at Lincoln Disc and Nutrition Center here in Lincoln, Nebraska, and today I want to talk about a couple of studies regarding lower back pain. Now, one of the criticisms of chiropractic over the years, and this is primarily by people who don't know what they're talking about, is that we don't have any scientific evidence backing up what we do. And in fact, that could be farther from the truth. Nothing could be farther from the truth. So here's two articles that I want to discuss today on lower back pain, which should really alleviate any of those questions that you might have regarding science and chiropractic. The first article comes from the British Medical Journal, August 5th of 1995. British Medical Journal is one of the most prestigious and well-respected journals in the world. And the name of this article is Randomized Comparison of Chiropractic and Hospital Outpatient Management for Lower Back Pain, Results from Extended Follow-Up. And what they did in this study is they looked at 740 men and women aged 18 to 64 years with lower back pain. And the primary outcome measure was a change in the total Oswestry lower back questionnaire score, which is a scientific and very valid questionnaire regarding low back pain and function. And this paper represents the results up to 3 years for all patients for whom follow-up information was available. And according to the total Oswestry scores improvement in all patients at 3 years, about the patients who were treated with chiropractic had 29% more improvement than those treated by hospitals. It said this in the article: more subjects rated chiropractic helpful at 3 years in hospital management. Said at 3 years, the results confirm the findings of an earlier report that when chiropractic or hospital therapists treat patients with lower back pain as they would in a day-to-day practice, those treated by chiropractic derived more benefit and long-term satisfaction than those treated by hospitals. Said other scores for the individual items on the Oswestry Index showed significant improvement in the following: the ability to sit for more than a short time, sleeping ability, personal care, lifting, walking, standing, sex life, social life, and traveling. Said chiropractic seemed to be more effective than hospital management, possibly because more treatments are spread over long time periods. So this is one study, and this is way back in 1995. Now, this study here is from the Journal of Pain, and this is February of this year. The name of this study is as follows: Reduction of Chronic Primary Low Back Pain by Spinal Manipulative Therapy is accompanied by decreases in segmental mechanical hyperalgesia and pain catastrophizing, a random, placebo-controlled, dual-blind mixed experimental trial. So this was, they looked at people with chronic lower back pain, 49 individuals, which they put under chiropractic care, and 49 individuals which received a placebo adjustment. And here's what they found out. Well, first of all, I want to give a few facts from the article. Spine pain is a leading cause of disability worldwide and is a definite economic burden. A recent study reported that lower back pain and neck pain were the conditions for which healthcare spending was the largest, exceeding spending for cardiovascular diseases and cancer. It was also reported that for lower back pain, ineffective low-value care is overused, and the effective high-value care is underused. This may worsen lower back pain and increase healthcare spending. Most clinical practice guidelines recommended spinal manipulative therapy for the management of chronic lower back pain. So they looked at adverse events from the adjusting, and they said all events were transient and self-managed or improved after further care within 12 sessions. Here were the findings. The randomized controlled trial found that 12 sessions of chiropractic care yield great relief of chronic lower back pain, and much greater than a controlled intervention or the placebo group. Mechanical pain sensitivity was greater in women than men. At the 8-week follow-up, clinical pain intensity remained lower for the chiropractic group than for the placebo. And at the 16-week follow-up, pain intensity remained significantly different between the groups. The present study shows that chiropractic care produces greater pain relief compared with a controlled intervention that was undistinguishable from spinal manipulative therapy. In other words, the placebo that they gave the patients was so good that patients could not tell the difference. Regarding the clinical significance of this effect, pain reduction after 4 weeks of chiropractic care was 65% lower than when they started. So here are 2 studies in very good journals that show that chiropractic care is more effective than hospital care, and it's more effective than a placebo, and that people are happy with it and they're satisfied with it, and it reduces pain significantly. These studies were primarily for lower back pain, but I have some more studies which I'll go over in the next few weeks, which show the other aspects of how chiropractic care can benefit human health. So I hope that you understood and you got some things out of these articles. I just want to say this, there are lots of people out there that suffer from lower back pain needlessly. And you probably know or have some names that come to your mind right now. And my plea for you would be this. These people need to at least get checked out. I may not be the right doctor for them. This may not even be the right clinic for them, but at least they need to be checked and given an opportunity to see if chiropractic can help them. And I am taking new patients. So if you want to have them call the office at 402-488-2220, we can schedule these patients for a complimentary checkup and see if there's something that we can help them with. If we can't, we'll send them to an office where they can get help, but at least they need to be checked. So that number is 402-488-2220. Hope you guys are having a great day today, and hope these scientific studies help clarify some things for you. I will be back next Wednesday with another 10 minutes of truth.